podcast is provided for informational and educational purposes only and should not be construed as legal advice. Because every situation is unique, you should consult with a qualified legal professional for advice specific to your circumstances. If you need legal guidance, please reach out to an accredited attorney or contact us to schedule a consultation. Hello, and welcome back to the Veteran Benefits Podcast. I'm your host, Rebecca Deming. Today, we have a special guest, Leah Bucholz. She's the founder and CEO of Prestige Veteran Medical Consulting, which is a company that provides medical opinions and disability benefit questionnaires to veterans. So, Leah, thanks for joining us again. We always enjoy having you on our podcast.
Yeah, thanks for having me. I always love being here. You've been on my show a few times. I've been here a couple of times. I always find that we have this awesome collaborative approach. And I've had a lot of great feedback about our, shows together. So hopefully this one will follow suit.
Yeah. So today we're going to be talking a little bit about something that's right up your alley, the kind of the difference between a disability benefit questionnaire, a DBQ, and a Nexus letter, and what role those pieces of evidence play in the VA claims process, and kind of breaking them apart and kind of understanding when to use them and how to use them strategically. So can you start off by maybe telling us the difference between a medical opinion and a disability benefit questionnaire?
Yeah, so this is a really great question. So I get this quite frequently, and I think it's just so important to know. So a medical opinion is just an opinion, right? So it's an opinion that a licensed medical professional can put together that discusses the relationship between a veteran's injury or illness and their service. Okay, so it's kind of like, well, let me circle back to that. And then a DBQ, on the other hand, is a disability benefit questionnaire, and it is a form that VA utilizes to help organize symptoms that align with your area, the 38 Code of Federal Regulation, that helps the adjudicators determine a rating percentage, right? And so for me, when I look at the very bare bones, is the Nexus letter is like, if you're talking about a light switch, right? Is it on or is it off, right? Is there a connection or is there not a connection? So that's going to show that qualitative relationship versus the DBQ, which is a more quantitative analysis that helps adjudicators determine that rating percentage. I hope that helps.
Okay. Yeah. So you used the word Nexus letter. Is that the same thing as a medical opinion?
It sort of. So Nexus letter is kind of like slang. That's what the veteran community likes to hear. So Nexus letter is what we think of when we think of that, again, that nexus, that relationship between service. A medical opinion is kind of the more highbrow way of saying, Nexus letter. What is the medical opinion about this relationship between, causation or aggravation in the veteran service? So it's always important, I think, for veterans to understand that a nexus, from my understanding, is always required, right? But that doesn't have to come in the format of a Nexus letter. So people conflate those issues a little bit, I think. So a nexus, the relationship between the service and the injury or illness must be described, whether that's at the CMP exam or in a letter or a statement from the veteran's treating provider in the medical record. But a Nexus letter is just another piece of evidence that can be associated with a claim.
And so when you're evaluating whether there's a connection or not, do you guarantee that you're always going to find a connection, or can you always find a connection for veterans between a condition and their service?
So that's a great question as well. So the only thing I can guarantee is that I'll do a thorough job reviewing the records and give you honest feedback, right? So sometimes that feedback is negative, right? And so to me, like, to maintain credibility, the opinion has to really be grounded in the evidence of record, the lay testimony, the medical research, confounding variables, like what are the risk factors. So we have to look at all of these fact patterns to determine whether or not we can provide a medical opinion when weighing all of those things together. And sometimes, unfortunately, the answer to that is no, because again, to remain credible and to provide you the best, the law firms and the veterans the best service, it has to be not just because I said so. It has to be, well, because I said so and here's why, right? That supports my opinion.
Okay. And is it like, are certain conditions always connected to other conditions, or does it vary from veteran to veteran? How do you pick that apart?
Yeah, so that's a great question. And we were actually just talking about that recently offline, is that there's really no such thing from a medical perspective as precedence when it comes to condition A being related to condition B, for example, because every veteran is unique and different and they have their own circumstances and their own history. And so just because, you know, somebody's sleep apnea is related to their rhinitis in one veteran doesn't necessarily mean that's the same for another veteran, because the other veteran might be obese or the other veteran might have had major facial trauma. So every case is unique, and that's really wonderful for veterans because that means that there's a very custom solution for their issue, right?
Right. So when you're trying to pick that apart and determine whether it makes sense for this veteran to be able to support a nexus letter or a positive medical opinion between their condition and service, what records or what evidence are you looking at in kind of forming your opinion?
So I like to, the things, if I have, I don't always get everything, right? So sometimes we're limited by, if it had to do with that fire that you guys always talk about where veterans lose, where VA has lost records, or maybe the veteran doesn't have certain things or whatever. But in a dream world, I would have their claims file, right? I would have all of the relevant VA medical records, service treatment records, their personnel records, even I like to look at depending on certain things, mostly related to their exposures and their duty assignments or what their job might have entailed while they were in the military. I like to know, I'd like to look at their lay statements, any buddy statements they might have. I like to know what their post service job was. You know what I mean? So I like to look at all those kind of things. Their family history can be important. But again, you might have 10 risk factors that are negative, but you might have so much overwhelming positive evidence. It just has to all be weighed next to each other.
You've been a CMP examiner in the past. You're certified to be a CMP examiner by the VA contracted exam companies, right?
Mhm.
So what is the difference, if is there a difference between the medical opinions that you're writing in a private capacity or an independent medical opinion and the opinions that a veteran might get at a CMP exam?
So there definitely can be, and it can be dependent on the person too. So everybody has their own writing style and their own, unique way that they formulate their opinions and their own creative process. And I don't mean creative process in a sense that I'm just imagining things, but the way that I think and I critically think and put together an opinion is a lot different now that even than it was 7 or 8 years ago when I was doing CMP exams, because I just have such a larger volume of things that I've seen in the past. So just like regular medicine, the more times you see certain things, the more you can just pull from that knowledge base. So those opinions that I did as a CMP examiner, and even the opinions I currently read in my current capacity, I read a lot of CMP exams. I don't want to say they're not always as thorough, right? But I can, sometimes I can write a 10 or 20 page medical opinion, right? That's not always necessary at all. But sometimes those VA medical opinions are very limited to just a couple of sentences. But I also have seen VA medical opinions that are super robust as well. It's just not as common.
So that's really helpful. So just so the veterans kind of understand, like VA has a duty to assist. And so if there's no evidence to kind of trigger them to get it, that there's something there, they should be sending the veteran to get a CMP exam medical opinion, but those might not always be as robust as the ones that you're going to get from a private examiner or private medical expert, especially if it's kind of a complex issue where it's not super obvious. Like if you broke your leg in service and you still have residuals from that broken leg, like you might not need a medical opinion, right? Or a private medical opinion.
Right. So, and again, they're never required, as you know. I would like to think that if somebody, for example, had a leg amputation in service due to an IED, like that probably is not going to benefit from an external medical opinion simply because the evidence is so strong that it happened on active duty, in the line of duty, all of those things. It should be very black and white. That doesn't mean that 100% of the time it's going to be gotten right, but it should be, right? If you're an infantryman and you've got tinnitus and you were seen for tinnitus on active duty and then you apply for it right after active duty, that's probably going to get service connected. Does VA make mistakes? Sometimes. But you would hope that, more obscure cases are the areas or ones that have been denied over and over again. Those are maybe the ones that could benefit a little bit more from an external medical opinion.
Yeah. No, that makes sense. Okay, so we've kind of talked a little bit about like the medical opinions and the role of a medical opinion in the process. So I want to pivot and talk a little bit more about the DBQs, disability benefit questionnaires. Can a veteran get a private disability benefit questionnaire, or does VA have to do those?
So that's a great question. So yes, veterans can have their treating provider or any licensed healthcare provider that's licensed in that field, right? We don't necessarily want to have chiropractors filling out PTSD DBQs. Yes, you can get your own treating provider to fill one of those out. VA does, they have tons of help docs, which I think I direct veterans to quite often. VA actually has a pretty robust library on va.gov of just help docs that explain things. They have a whole page full of all the public facing DBQs that you can just download and take to your provider and ask them to complete. Or a company like mine, we can complete a number of DBQs as well that can be done virtually.
So when you say you can do a DBQ virtually, can you talk a little bit about how that process is done if you're not physically examining the veteran?
Sure. So as far as my company is concerned, we can do any number of DBQs that can be done that can be done by review alone, right? So I can't do any orthopedic DBQs because they require a physical examination most of the time with range of motion and different physical exam things, with the goniometer and things like that. So we can't do those from our remote virtual platform. We also don't do any psychiatric DBQs because those really, really require a face-to-face evaluation. It can be done via telehealth, right? You can do it on telehealth, but we personally do things based on records review alone. So that's not something that we can assist with. But there are companies out there that will do telehealth exams for those types. But we can do ones that, headaches based on, history alone, things like that, GERD, IBS, asthma, things like that.
So when you say you can do it based on history alone, is that like when you're reviewing the records, how is that different than if somebody, or is that different at all than if somebody went into the doctor and talked to the doctor and explained their headache symptoms or something to get it written down in a physical exam?
So it can be done either way, right? So if someone gets on a telehealth interview or they supply me with the information like in written format, some of those questionnaires are really subjective, meaning that they just require history, right? Some of them are objective, meaning that they need a hands-on like an assessment to be done. So the ones that are basically completely subjective based on the report of the person, they can be done by review alone if the veteran provides those responses in written format, or if they go in and see their doctor and they just get interviewed by their doctor. It's very similar. Or if they go to the CMP exam or whatever. Often, a lot of times, the CMP exams don't even call veterans for those. They do something called an ACE exam, acceptable clinical evaluation?
Evidence?
Acceptable clinical evidence. Yeah. Right. And so they can do it. They can either call the veteran and ask them some questions over the phone, or they don't even call them and you just look in the record and they jot it down.
So like if, for example, if I had headaches and I was getting treatment for it, not even for VA purposes, I'd go into my doctor and I'd say, "Hey doc, I'm having headaches this often. I get nausea with the headaches. They tend to come on in the mornings. They tend to last for this long." But I'm going to share that information with my doctor. But the doctor, before prescribing medication for me or like noting it in my file, isn't necessarily doing a physical exam for headaches, right? Could there be things that they could do for headaches physically, or is it really just
Not
a clinical
really.
history?
It's really just clinical history. I suppose there might be some fancy things in neurology clinics where they can hook you up to machines and like look and see what kind of brain responses you're getting, but that's not something that's required in any way for the DBQ. So the DBQ for headaches, for example, is completely subjective. It has blocks that ask things like how frequently you're getting them, what associated symptoms you have, like you mentioned, nausea, vomiting, whatever. Are they prostrating? Questions like that are all interview based. So there's no real physical examination for that particular DBQ at all. It's just the interview questions essentially.
Okay. And the other ones that you guys can do, you said asthma ones, because that's based on how frequently you're having attacks.
It's based on that. And then there's some other things like what medications you're on, other findings like if you've had spirometry done. But again, that's not like if it's either in your record and I'm going to transcribe those reports, Sometimes VA will, like, if you haven't had one, they'll order you one of those spirometry tests, one of those, what do they call them? What's the lay term for them? Anyways, the test where
Is
you
that
go and
like
you
when you blow into the
yeah,
puffer
you
and
go
they
into
measure your
you go blow into the machine, and then they measure your different volumes, your different lung volumes and different outputs that you have. Sometimes the VA will order those for a veteran, but that's not even usually done the same day that the actual asthma DBQ is done. The provider will just have it to reference. But again, a lot of people already have those, and you're not even required to have that for just to have an asthma DBQ done.
I think one of the other ones that we've seen you do frequently is the IBS one, and that's typically based on clinical history, right? I mean,
So that one's based on clinical history. Even surprisingly, even erectile dysfunction can be done without an exam because veterans are. And when I used to do those exams a lot in clinic, veterans are able to like refuse that exam. They can say they don't want, to have their genitals examined. And honestly, from a rating standpoint, this is more your lane. Everybody's pretty much going to get 0% for that, anyways, unless they don't have normal anatomy. And then there's other factors that come in. So if a veteran's saying, "Hey, I have normal anatomy, have both testicles, I don't have any abnormalities," if they get connected, they're probably going to be 0% anyways. So a lot of them will just decline the exam, and we check that block, and then we just put the rest of the interview based stuff in there.
yeah, it's usually 0%, but it does qualify for special monthly compensation at the K level, which is, I think right now it's about $135 a month, adjust with cost of living adjustment. So that's a one that it's helpful for people to, it's one that I think people leave off because they just don't want to talk about it. But if it's something that's affecting your life, and not that $135 a month is going to make up for for the damage from experiencing that, but at least it's something.
And I think one other important thing I kind of forgot to mention in the beginning, and I wish I would have mentioned it earlier, but something that I think is super important that veterans get confused at is that DBQ does help with the rating percentage, and the medical opinion or nexus letter helps with that qualification, right? The yes or no type answer. So if somebody's already rated for something and they're just wanting an increase, in my opinion, there's no reason that they need a nexus letter, right? Because the nexus is already established. So if you're coming and you're saying, "Hey, I'm 0% for headaches, I want a nexus letter for this," I'm like, "For what?" Like, maybe, again, you could still technically in a narrative opinion write all of those things out, and they could be evaluated in a narrative format to help you get the increase. But VA just wants to see the DBQ. I mean, for the most part.
Yeah, and I think with the ones where it's by clinical history, that it's really helpful because sometimes the CMP examiner overlooks it. Or if you're not going to the doctor every time you have an IBS flare up or every time you have a migraine attack, sometimes the CMP examiners will discount your clinical history about what you're telling them happened and how frequently you're having these symptoms. So getting someone who's actually documenting what you're telling them is really helpful.
Yeah, that can be incredibly frustrating when especially often, the prostrating versus non-prostrating, I can see that being debatable sometimes. But when a veteran says, "I get, 3 headaches a month," and they put that you're getting them once every other month, I'm like, I don't understand this. It's a pretty cut and dry, like, what they're reporting. So
Yeah, I mean, I really like to see for veterans that I'm working with if they're keeping a migraine buddy app or a migraine log. And I learned recently that there's an app that can track your IBS symptoms too, and I think it's a free app. Don't quote me on that, but I think that would be helpful for me working on a claim. Would it be helpful for you if you're writing in a DBQ, completing a DBQ?
I think it can be helpful, any kind of condition like that. Another one that came to mind was like people keep urinary diaries too, like if they're having, to describe the frequency of like any kind of urinary issue they may be having as well. It's tough for me. Like, I'm going to put what the veteran is saying their symptoms are. So from a medical perspective, whether I have like a migraine log or I just have their personal statement, like I'm going to take them at face value unless there's a reason not to. From I guess a legal standpoint, you might, I could see where having those additional documents to just really like push it home that, hey, this has been their history, can be even more supportive as well.
Yeah, I mean, I find it helpful, like from because it's hard to remember, like especially when you have a headache. I mean, for headache ones, especially, I feel like it can kind of impact your memory. It's just when you have that much pain, it's sort of like you just want to crawl into a hole. And so remembering how frequently you've had it, unless you're missing work, and you can pull up your work logs, or if you're keeping a contemporaneous record, you can be like, yep, it happened this frequently. It was Tuesday last week, and then Saturday, and then Monday, and then, so it helps substantiate as opposed to just, yeah, I think it was about 5 times last month.
Agree.
I think it adds to the credibility. Not that you need it, but I think it adds to the credibility if you can kind of keep a contemporaneous record.
Agree.
Recently, we've been seeing VA deny claims saying that the DBQ was completed by somebody who was more than 100 miles away from the veteran, and that that's a sign of fraud. Have you seen that? Do you have thoughts on what that is?
I have seen that. I wish you would have prepped me in advance because I have I actually just responded to a VA regional office in conjunction with an attorney on this recently. And I had a really great response that I sent because I feel like there are fraud indicators that VA put together that they're looking at to sort of make sure that there's legitimacy in some DBQs. So I think as a whole, the M21 says, and remember, M21 is a policy, right? It's not, it's VA's internal policy. And it helps their adjudicators interpret federal law or whatever. So it specifically says something of the fact, like, we should not be discounting, just automatically trying to discount private medical evidence. So it should be taken at face value. That's the first part of the whole section, says private medical evidence should be taken at face value unless there's a reason not to. So they shouldn't just be hunting reasons not to. Some indicators of fraud could potentially be the 100-mile radius, right? Now it says could potentially. It doesn't say that, hey, we have to throw this evidence out because the person's 100 miles away. And I think a lot of people are doing that, which is crazy. Now, some of the instances where you may say, hey, this is a little red flag, let me look into it further, would be it's an orthopedic DBQ and the person is more than 100 miles away. Now, that doesn't mean it's automatically fraudulent, but it could say, let me just verify the authenticity of this, okay?
Did they drive 100 miles to have somebody take measurements on their range of motion? Or did somebody say that they have range of motion and they were doing it via telehealth or record review when you can't get the physical symptoms recorded?
Well, and they're looking for this fraud, right? But like it's like they're way overshooting in a lot of cases and just throwing medical evidence away unnecessarily. And I feel like they could really do better with this because not everything is fraudulent, right? And this is supposed to be for DBQs. I've seen them do it, like extrapolate that to medical opinion letters. Where does it say that, right? I've seen them do that, and there's the provider's information is right there. Did they pick up the phone and call the provider? No. So it's sort of, I think, being the purpose of it is great, but I don't think it's being applied in the best manner. And I think that there's great legal professionals out there like you guys who can kind of continue to, fix these issues and help the situation.
Yeah, I wanted to raise that because I think you hit the nail on the head with exactly kind of what's going on and the nuance there. And I think if somebody did get a medical opinion from someone like you or another reputable ethical provider out there, and it was more than 100 miles away because they're doing a records review or they're doing a telehealth assessment, when we've seen this with mental health and it's a telehealth assessment, which they're setting up a video conference. It doesn't matter if you're in the same room or in the same state. And VA's kicking it out because that 100-mile rule. And so I want people to understand that it's not really a rule and it's an error when VA does that. And it's something that we can fight. And they shouldn't be coming back to you and saying, oh, you didn't provide me a good letter. You didn't provide me a good DBQ. Your product was somehow faulty. Because VA didn't process it correctly.
Well, and even in my reports and all my reports and DBQs, I'm very explicit. And I say that, this evaluation or this DBQ or this medical opinion was completed by records review alone. I have some other disclaimers I put in there, but I'm very explicit in the way that the evidence, I put this particular piece of information together, and very transparent. So that's kind of my thoughts on that.
If somebody were going to have their private doctor fill out a DBQ or a medical opinion for them, is there anything specific that they should be telling their private doctor to include in that opinion?
That's a really great question. I think that, a lot of people like the phrase at least as likely as not. If that's not in there, that doesn't mean that it's not a good piece of probative, like have probative value and evidence. But I think if they can put that in there, that can sometimes be helpful, that their opinion that it's at least as likely as not that, the left knee is related to the right knee. I think that's helpful. I think that it should have, you know, an introduction of who they are, like, hey, I'm their treating doctor, I'm an orthopedic physician, whatever. It should have their license number if they can put it in there. These are not requirements, but these are things that I think can be helpful. Their contact information, a brief history, even if it's just a sentence in their medical record. It doesn't even have to be a separate letter, but if it's in the medical record and it says, hey, it's my professional medical opinion that this is the left knee is related to the right knee due to overuse or due to gait abnormality or whatever, that can be helpful. So best case, they explain who they are, put their contact information, put some research behind it, some peer-reviewed medical research, and an analysis of your history. If they have your claims file and they want to put that they've reviewed that, that's helpful, but again, not required.
Yeah. We've seen VA kick out medical opinions at the lower level for just stupid reasons, or, it's kind of they're reading the regulations very black and white, or their internal policy very black and white, and they're rejecting stuff that they shouldn't be rejecting. And then they're giving more weight to a CMP exam that has like a 2-sentence explanation and ignoring
Right.
your 6-page report and something. So that doesn't mean that your report is less probative. That means that VA is not doing their job right. And that's where we come in to kind of argue and kind of understand where we need to add evidence, or where we need to argue that that VA didn't weigh the evidence properly.
Agree. Unfortunately, that does happen, but I think that all in all, at the end of the day, if people keep persisting and getting the resources to help them push through, if they have good, credible medical evidence and a good history, that you can get through some of those roadblocks.
So one of the terms that we've seen people asking about a lot is a rebuttal opinion. I know people come to you sometimes and ask for a rebuttal opinion. Can you explain what they mean when they're asking for a rebuttal opinion, or where that term even comes from?
So I absolutely hate that term, and I'll explain why here in a minute. But there's a few different ways people use that term. So sometimes they can just be straight up asking, hey, I'd like a rebuttal opinion because the VA exam gave me a bad one. I'd like you to rebut what the VA examiner is saying, right? And then sometimes it's like, hey, you provided me opinion, and then I went to an exam. They said no for these reasons, and I want you to provide a second opinion to go back and argue against whatever happened, okay? So in my frame of mind, a rebuttal, for the most part, is appropriate to be done by a legal professional, because if we're arguing against an administrative decision, that's a role for a legal professional, VSO, accredited claims agent, or attorney to do. Now, if there's something very specific in the record that is like very technical and outside of what a legal professional would really understand, then sometimes a required medical response could be helpful. But again, that's just an opinion. So that's kind of where I'm at with it. What I don't like is when veterans are like, hey, VA didn't even read your opinion. It's not even listed in evidence, but I want you to write another opinion just to go against what happened in my last adjudication. And I'm like, bro, like your opinion wasn't even in there, the first one. Like, why are we writing a second one to just regurgitate the same thing that already had? If it's a procedural error or procedural issue, we really need to know what was the issue. We don't just shotgun blast things at the wall, right? It's like, what was the actual matter at hand and the issue at hand? And that should be surgically dissected so that we can, like, whether it's me, like you, there's very separate roles and there's very separate scopes. And I should not be responding on something that's an obvious legal scope, right? So that's kind of where I'm at with it.
Yeah, I think that makes a lot of sense. Sometimes people think, well, if I have like 6 opinions, is that better than 2 opinions or something? And I think that's just a misunderstanding of how the VA system works. It's not like the number of opinions you have is going to outweigh their opinions just because you've got more. I think it's really about the quality of the opinion. Although, of course, VA kind of has a bias. They're not supposed to have a bias against veterans, but they do have a bias towards the CMP examiners.
It's hard because it's nothing. I don't feel like anything's ever black and white, and we can say this, and in the perfect world, that's true. But then also, you could get somebody who just presents with 17 private medical opinions, and the rater is just like, oh, they have 17 medical opinions, so there's one VA one, there's 17 over here. I'm gonna go with this because there's just they don't even look at the quality. They're just like very robotic in their approach. And that can be for or against the veteran sometimes. But if they're actually doing a good quality job of reviewing the evidence and actually weighing it like textbook the way it's supposed to be done, it should be based on the probative value, quality, all this kind of stuff, not numbers. It shouldn't be, oh, well, this was a 20-page Nexus letter and this was a 2-page Nexus letter, so I'm going to go with this. And just the same as like Leah as a PA, she wrote this letter and this cardiologist wrote this letter. Well, if the cardiologist didn't do a good job at all, I don't really care what they said. If it's not
Right.
fact-based or, whatever.
Yeah, no, that makes a lot of sense. I think as a representative, as an attorney who's working on these cases, the times that I would come back to you and ask for a rebuttal opinion or like an additional, I probably wouldn't call it a rebuttal opinion. I would call it an addendum opinion or a new opinion if we haven't gotten one from a independent medical expert before. The things that would make me want to ask for one would be like if VA brought up a theory that kind of could be challenging and I want you to expand on that or explain it or pick it apart and show why they're actually wrong in this situation. So, like if they say, "Hey, you're a smoker and you have asbestos, so your lung cancer can't be related to service," and we hadn't previously addressed smoking, like maybe you can do an opinion that talks about the synergy between smoking and asbestos and like really pull that apart and pick it apart. But it wouldn't be a rebuttal opinion in that case. It would just be kind of like an addendum opinion or a new opinion that addresses a different angle of the case if VA raises issues or red flags.
And I think that can be definitely appropriate. So I guess that type of opinion I think can be really helpful sometimes. I just think 95% of the time we're kind of misusing the terminology. And then the 5% when it's super helpful and tactical in the approach, I think it's great for sure.
But I can see people just kind of getting confused between my role as the attorney and your role as the medical expert. And they get denied and they're just like, well, I thought you were going to give me something that would win my case. Can you give me more? Because the first one didn't win my
Yeah.
case. And that's not always the surgical answer to the problem.
Yeah. And a lot of times I get kind of upset because I feel like I want to support veterans in every way that I can, but sometimes I can see what the obvious error is. The obvious error is there's a legitimate procedural or legal error that's outside of my scope. I can see it, right? And they want me to comment on it so that it can reopen their case or do whatever. And I'm like, and a lot of medical professionals will do that either because they're inexperienced, they don't really understand the like scopes, or they just, a lot of times there's people out here who will do very unprofessional things, medical professionals who will like get very emotional in their reports. They will like use profanity. I've seen it. And veterans get very like amped up and they're like, oh, this provider really cares about me. And whether it's because the provider is just kind of inappropriate or they're just pandering to that kind of emotional response for different reasons, I don't think that's professional. And I think it actually decreases the credibility of the opinion because we're supposed to remain scientific and objective. And it's the attorney's job to do all that ripping and tearing, right? And so while I want to help the veteran, I say, like, I'm sorry, I cannot just sit here and say, hey, you guys are idiots. You didn't look at the medical opinions. That's not even listed in the evidence section, or it's not in the claims. It was just clearly, mishandled or whatever. While I wish I could say that, that's not my role to do that. Right. So the veteran can do that themselves. If they're representing themselves or whatever, they can use a VSO or an attorney to do that.
From a human level, if VA ignores your opinion, it eats away at you, doesn't it?
What there's a difference between ignoring it and mishandling it and not even having it, right? So if it's been mishandled, meaning either the veteran didn't submit it correctly or like whoever is putting it together to send it over for review didn't include it, I think that's human error. And I would hope that it's human error, not intentional, like disregarding of the opinion. But if it's in evidence and they just say something like, oh, we received your private treatment, but we go with our examiner over yours, that pisses me off, especially if there's no supporting rationale for that. If they're just saying, well, we got it, but we think that our opinion is more, what's the term they always use? It's more
probative. Our opinion was more probative than your opinion because it was based on a more thorough review of the records. And I mean, it's cookie cutter language that they take and they place into a lot of these decisions. And it frustrates us as representatives. And I mean, it's so when you're saying that you don't want to write it or that you won't write a rebuttal opinion or attack VA for getting it wrong or something, it's not because it doesn't bother you. It's because that's just not the appropriate role and the most strategic use of your time. And
right. And honestly, like it really upsets me if they acknowledge my opinion and then they go with their opinion with no rationale other than it was based on a more thorough review, especially if I have the C file, right? Like I'm just like, on what basis? Like what kind of, this is not even an adequate response. Like, I don't even believe that that's an adequate response at all. And it does piss me off. And I do sit in this chair, maybe not so much at that one anymore, but I've read things that really get me fired up. But again, like in order to, if these adjudicators see my name on a bunch of stuff and I'm just getting nasty all the time, like how is that going to help the veteran community long term for me to, and there are ways to politely say things, I guess. But
to be clear, we typically don't get nasty either. I mean, sometimes we'll add some snark into our opinions or into our arguments if it's really warranted. And sometimes we'll write them really snarky and then we read it again and tone it down to make it professional and because our goal is not to like just have an outlet for our anger and frustration when VA gets it wrong. But our goal is to get the veteran the benefits they deserve and to help the person on the other end understand what VA got wrong the first time and get them on our side and try to help them correct it the second time around when we're filing these appeals.
for sure.
Well, is there anything else you want to tell us about CMP exams and DBQs and medical opinions?
I think this is just kind of off topic, but I always think about that veterans get really nervous when they go to CMP exams, and they used to get very nervous when they would come and see me. And I always try to be like as kind and supportive and disarm them as possible. I know that doesn't always happen, but just try to go in there almost like you're on a job interview. Be very professional. You shouldn't have to be like kissing up to anybody, but some kindness goes a long way sometimes. So just try to be professional, stay on topic, right? Don't ramble about 16 things if you're there for one or two things, stay focused. And I guess that's the only other additional things that I could think of.
And I think that's really good guidance because people do get nervous going into CMP exams. And if they understand if they pull up the DBQs, they understand what the examiner is going to be looking at and rating them or not the examiner's not the rater, but if the kind of the symptoms that the examiner is looking at to fill out for the rater, it can help them kind of gather their thoughts and gather their medical records and be prepared to answer questions on the appropriate topics for that disability.
For sure. Yeah.
And I always tell people, not always, but if I think it's a risk, I'll tell people not to get in arguments with the CMP examiner at the exam. If you get someone who's not giving you the time of day, like that's not the battlefield to fight your battle.
I agree. Now the examiner doesn't make the decision, right? That's a lot of people don't really understand that either. It's that the rater, adjudicator, or whatever, they make the decision, but they often take the examiner's opinion into high regard. Not always. Sometimes they go against their own examiners for good or for bad. But it's not up to the examiner. And sometimes the examiners don't even realize that. They think that they're in control and they're not. Sometimes they put stuff in there that they have no business talking about. They shouldn't be weighing evidence. They shouldn't be talking about your other medical opinions or, your treating doctors. They are asked for their opinion on the condition. I've seen examiners say that somebody shouldn't be service connected, like straight up, like this person should absolutely not be service connected for this. And I'm like, whoa. Like I've read it in claims files and I'm like, holy cow, this person should not be seeing veterans.
Awesome. Well, I thought this conversation was really helpful. I think it will hopefully clear up a lot of kind of the confusion and common terms that are floating around on the internet that people might be confused about. So I really thank you for joining us and kind of giving us some clarity on these topics.
Yeah, for sure. Thanks for having me. And, you know, hopefully I'll be back here soon, or I'll have you over on my channel soon, and we'll definitely get some good info out to these veterans.
Definitely. Well, Leah, we'll put your contact information in the notes section so that people can reach out to you if they want to get a medical opinion or a DBQ for their case. And if you have other questions or comments, please put them in the comment section, and please like and subscribe, and we'll see you next time.